My name is Allison Payne, and I will be demonstrating a bed bath and oral hygiene and nail care. Okay, to begin, I would enter the patient's room performing hand hygiene, identifying myself. Hi, my name is Landry, and I'm going to be your nurse today. Okay, then I would identify the patient using two forms of identifiers, the patient's first name and last name, and their date of birth compared to their hospital identification band and my charts. Alright, and then I am going to explain to the patient what we'll be doing. We are going to be performing a bed bath today to clean your body. Okay, and then I would explain why we're performing the bed bath while performing hand hygiene to prepare for the bed bath. Okay, and we do bed baths to ensure cleanliness of the patient and also to prevent infections, any bed sores, skin irritations, just to make sure that they're really clean and comfortable for their stay. Okay, and we're going to start by making sure I have all the equipment necessary for the bed bath. Okay, I'm going to have a number of bath cloths depending on your hospital preference or policy. I'm going to have a bath blanket and a bath towel to place under the extremities while washing them to ensure that the sheets don't get wet or soiled while bathing, because you don't want, then you would have to change the bed sheets and you don't want to continue to change them after if you had just changed them. Okay? Alright, I'm going to begin by placing the bath blanket over the patient, again to ensure that we do not wet the blanket or sheet. Alright, and for keeping the patient covered. Alright, in a real hospital setting, I would remove the hospital gown, and since we are videoing for Corona and he does not have a gown on, I will be explaining it. You're going to start by removing the side that does not have the IV on it. So you're going to untie it, remove it, and then take the IV off the stand, threading it through the arm of the gown, ensuring not to bump the IV site or causing any irritation with that IV. Okay, you're going to hang that back up and continue pulling the gown off, placing it in the proper disposal receptacle. Alright, we're going to start by grabbing our bath towel, getting our hand mitten ready, and then you have a basin of either plain water or soap, depending on the patient's preference. Alright, we're going to dip our bath towel into the basin, wringing it out, ensuring that it is good and soapy or just water. Then we're going to start with the patient's head. Again, in a real hospital setting, I would place the bath towel under the patient's head if they were in a lying position to ensure not wetting the pillowcase or sheets. Alright, I'm going to start with the eye furthest from me, going outer to in. So we're going to go out, from inner to out, excuse me. Alright, and then we're going to, again, dip the basin so you don't cross-contaminate any infections in the eyes. Bring it out. And again, we're going to go inner to outer, wiping the eye. Alright, and then rinsing the bath cloth. Alright, and then we're going to go from the forehead all the way to the cheek, and due to coronavirus, we have some patients with masks if they are coughing or have a fever. So with the mask, you're going to remove it, and going from forehead all the way down the cheek and under the chin. Okay, and then you're going to place the mask back on the patient's face, removing the other side, and going again from the forehead all the way down and down their neck. Then we're going to replace the mask, okay, and fix it to where it's properly placed. We're going to rinse our mitten again in the basin and place the bath towel under the arm to begin bathing the arm. Okay. Make sure if patient needs assistance, you are supporting the joint that is being moved. And we're going to come get our bath mitten, soak it in the water, wring it out, and starting from fingertips going all the way to the shoulder, you're going to take long, firm strokes, going from fingertip to shoulder, fingertip to shoulder, fingertip to shoulder, ensuring that you're cleaning the entire area to prevent infection. All right, you're going to make sure to get the hand and the fingertips really well, lifting, again, supporting that joint, going from fingertips all the way down to the shoulder, fingertips to shoulder, fingertips to shoulder, and ensuring you wash the armpit area. Okay, we're going to place that back down. Ensure to dry the extremity in entirety to prevent any kind of infection or just them being comfortable. All right, and then you're going to dip the water basin, put the bath cloth in the basin, remove the bath towel. All right, we're going to go do your other arm now. Okay. Placing the bath towel once again under the patient's arm. Okay, ensuring that we do not get the sheets wet. All right, then we're going to get the bath towel, form the mitten. Okay, dip it in the basin, wringing it out. Again, going from fingertip to shoulder, fingertips to shoulder, fingertips to shoulder, supporting that joint and getting fingertips to shoulder, fingertips to shoulder, fingertips to shoulder, and that armpit area, ensuring that you get the armpit and the fingers clean very well. Then you're going to place that in the basin, get a dry towel, dry the extremity. Okay, take that from you. All right, we're going to go over to this side, and I'm going to do your leg now. All right, you're going to uncover the patient's leg that you're about to bathe, ensuring that you keep their privacy secured and only uncovering what you're going to be bathing. All right, again, supporting that joint to get that bath towel under there, getting the bath cloth and performing that hand mitten. Dipping it in the basin and wringing it out. Okay, with the leg, you're going to start toes to thigh. Okay, toes to thigh, toes to thigh, toes to thigh. Again, with firm, long strokes. Making sure to clean the entire extremity to ensure maximum cleanliness. Again, supporting that joint, lift the leg up, going from bottom of the leg to the top of the thigh, bottom leg, top to thigh, getting the entire back of the extremity. Also, you want to clean the bottom of the foot very well, and in between each toes and getting the foot very well. All right, then you're going to dry the extremity and remove the bath towel. All right, we're going to cover the patient back up to ensure their privacy. And we're going to go, and I'm going to do your other leg now. Okay. All right, you're going to uncover that leg and place the bath towel under the patient's leg. Okay, again, dipping your mitten into the basin, wringing it out, and repeating toes to thigh, toes to thigh, toes to thigh. Lifting that leg, ensuring you're helping the joint, toes to thigh, heel to thigh, ensuring that you cleanse the entire extremity. Okay, then you're going to again clean the entire bottom of the foot in between each of the toes and make sure you have cleaned every spot of that extremity and dried. We're going to remove the bath towel. All right, and cover patient back up. Okay, go this side. And we're going to be cleaning your chest and abdomen now. So we're going to roll the blanket and the bath towel back, keeping the bath blanket where, again, you will not soil the sheets. And in most cases, you would be placing the bath towel under the abdomen and back of the patient. Again, to not wet the sheets. So now I'm going to form the hand mitten. Again, dipping in basin and wringing out. And you're going to do long, firm strokes beginning at the waist to the top, so up, the abdomen, ensuring that you clean all the area very well, ensuring that you get the sides. Okay, and then you would dry the area and cover the patient back up. So we're going to cover you back up. Okay, and then for their back, you would roll them over and clean in the same way. You would go up with long, firm strokes, ensuring that you clean the entire area and their bottom. Then dry the area and ask the patient if they would like lotion. So do you want me to apply some lotion today?
No.
Okay. All right, if they say no, then that's their preference, and you move on to oral hygiene. For actually, you would clean the perineal. To clean the perineal, for a female patient, you would assist or instruct the patient to spread the labia with 3 different clean bath towels or clean towelettes. You're going to start from the furthest from you, wiping front to back, closest to you front to back, and center front to back, using a different towel each time you wipe. Then for a male patient, you're going to hold the penis in your non-dominant hand, lifting it up gently, cleaning upward around the shaft and around the medius, going from center to outward, using a different towel, ensuring maximum cleanliness. Then if the patient is uncircumcised, you will retract the foreskin and clean the tip of the medius, ensuring that there's no infection in that part of the penis. Okay, and then you will begin oral hygiene. If the patient is able to brush their teeth by themselves, you instruct them to do so while observing them, making sure that they are doing it to the full effect to get that maximum oral hygiene. And then if the patient is unconscious or unable to perform their own oral hygiene, you're going to roll them over to the side facing you. Starting with furthest away from you, you're going to brush side to side, getting the gums really well, but not too roughly to ensure you don't cause gum bleeding. Okay, you're going to start furthest away from you, closest to you, front, and then make sure you get the tops and of the teeth. Okay, and then rinse their mouth out with water. For dentures, you're going to apply gloves and have gauze, and ensure that the patient does actually have dentures. So do you have dentures?
No.
Okay, so this patient does not have dentures, and he has already performed his oral hygiene himself. But for dentures, you would have gloves and gauze, and you're going to pop the top denture off first by pulling down gently with a firm grip and place that in the basin. Then you're going to get gauze and pop the top denture out, placing that in the basin. And depending on patient preference, they can leave them out for a little while and kind of rest their mouth, or you will have them cleaned and placed back in the mouth. Okay, for nail care, you can either before or after, or during or after, you'll soak the hands in a basin of water, and upon patient request, you can trim and file the fingernails to the patient's liking. It's also a good time to ensure checking their nail beds, the color of the fingernails, to ensure that there is nothing, no underlying condition happening. Also during the bed bath, you'll be watching for or looking for bruises, new form bruises and cuts, scrapes, any infections that have not been noted on the chart prior. Okay, and then you would perform hand hygiene and remove all your blankets, bath towels, and dispose of them in the proper receptacle, and you are finished.